when we left off yesterday, we had finished up with pertussis, just talking about it very briefly. And so the next slide we're going to talk about, and the next condition we're going to talk about, is bronchiolitis. For those of you who've done the sim already, you've been introduced to this a little bit, but bronchiolitis is one of the most common respiratory infections that we see in the pediatric population, particularly in infants and toddlers. Most common etiology for it, first of all, pretty much all of them are caused by viruses, and the most common virus is going to be RSV, or respiratory syncytial virus. There's a reason we call it RSV. Because it's a viral infection, and what's going on here pathophys-wise is that not only do we get inflammation and invasion of the virus in the upper respiratory tract, but we also get it down into the lungs, and because their airways are so small as infants and young toddlers, it's not just a bronchitis like you hear about in adults, but it actually gets down into the bronchioles. And so the patho here is that viral infection triggers a massive inflammatory response, like a bad cold would, and causes inflammation of the mucous membranes lining the bronchioles, causes increased mucus production, and also, in some instances, but not all of them, causes some bronchospasm or irritation of the smooth muscles surrounding those bronchioles and causing some bronchoconstriction as a result. The presentation of it is a lot of what we talked about with upper respiratory infection, but additionally, these kids will present with a pretty significant cough and also wheezing. Now, the wheezing here is due to a couple of different mechanisms. One is that if it's bad enough to have caused some bronchospasm in the patient, that narrowing of the airway from the smooth muscle constriction, like we'll talk about shortly with asthma, will result in wheezing. But also, because there's so much inflammation and so much mucus production, that significantly narrows the airway. And remember, back to health assessment, what we know about wheezing is that wheezing happens when airways get narrow. It's essentially the exact same mechanism as what we see when you whistle. You narrow the opening of your lips, you push air through it, and you get a high-pitched whistle or a high-pitched sound. Okay. The YouTube feature here gives you some sound clips of a little girl with bronchiolitis, shows you a little bit about the retractions that she had, and also you can hear some of the audible wheezing. Management-wise, since this is caused by a virus, we don't have a magic wand to make it go away, so the treatment here is going to be supportive care. So again, going back to what we talked about with upper respiratory infections, and this is part of why we spent so much time on that yesterday, elevating head of bed, mucus secretion control, bulb suctioning, using saline drops, sucking out noses before they eat, things like that are going to be crucial. Okay. In some cases, kids have enough distress with this that we do go ahead and admit them inpatient so we can keep an eye on the respiratory status. And in severe cases, we do end up intubating kids, and in really severe cases, rare cases, we actually have to be even more aggressive than that. The parent education here, again, is going to be the key piece. So, back to management for a second. One of the things that we will try with these kids, because they're having wheezing and because one of the components of the patho may be bronchospasm, we give them a trial dose of albuterol. It's a bronchodilator, short-acting, very safe. If they improve and they stop wheezing after their breathing treatment, then we know that part of the disease course for them is that bronchospasm, and we'll go ahead and send them home on nebulizer treatments or continue those nebulizer treatments if they're in-house because they're beneficial. But remember, we said that some of the wheezing is simply caused by that excess inflammation and mucus production. And so in those cases, the albuterol treatment isn't going to do any good. It's just going to give them all the side effects of albuterol, so tachycardia and jitteriness and all of that lovely fun making them miserable. So in those cases, we're not going to keep going with the albuterol treatments because they simply don't have any benefit with them. So parent education is going to include, if we're sending them home with a nebulizer treatment, we need to teach them how to use the nebulizer, how to dose, how frequently, things like that. We also want to, again, review with them some of those secretion control things, bulb suctioning, using saline drops, especially before they eat and before they go down to bed. And then crucial here, again, is going to be those signs and symptoms to watch for. So we're going to encourage hydration, small amounts frequently, Again, half as much, twice as often, like we talked about yesterday. We're going to want them to watch for a number of wet diapers. Less than 6 months, we want 3. Over 6 months, we want at least 2 in 24 hours. We are going to, again, teach them to watch for retractions, count respiratory rate, and if they're over 60, we definitely want to know about it. And if the child just really is not keeping up, getting worse, we definitely want to know about that as well. Unfortunately, this is one of those viral infections that can last a week, 10 days. Not as severe as influenza, but just that extra mucus production is ongoing. And so sometimes those kiddos do have a rough time. Other kiddos do fine with it. That's it on bronchiolitis for this clip.